Hi there, everyone. Welcome to SCB TV Channel 182's new television show, The Dose, presented by Sweet Spot Smiles. The Dose is an engaging new health program that highlights top medical professionals and services in the community. We'll serve up a dose of information just for you. Let's get informed with Sweet Spot Smiles, Resurgence Orthopedics, 360 Med Spa, Sports and Spine Institute of McDonough, Southern Grace Hospice Care, McDonough Family Eye Care, HP Hyde Prosthetics and Orthodontics, Eagles Landing Diabetes and Endocrinology, Eagles Landing Family Practice, Eagles Landing OBGYN, Covenant Care Pediatrics, and Mercy Medical. Welcome to The Dose.
What if you looked forward to going to your dentist? What if you could have complete confidence in your oral health care from your dentist? Introducing Sweet Spot Smiles in Locust Grove, where we build your confidence in our team that cares about you. Your worry-free smile begins at Sweet Spot Smiles. Invisalign, oral health, cosmetic dentistry. Sweet Spot Smiles in Locust Grove.
Are you still getting that puff of air when you go to the eye doctor? Are you still going through the side effects after having your eyes dilated? Get out of the dinosaur age. Come to McDonough Family Eye Care, where they have the latest technology to get the most thorough and comprehensive eye exam. That's the McDonough Family Eye Care, 1044 Avalon Parkway in McDonough.
Found that I had breast cancer in '04. The compression sleeve that I was wearing was not working. But when she fitted me, it's like a new person, you know, excellent quality. And like I said, I think I have made a friend for life.
Since 2008, Mercy Medical Supply and Mastectomy Boutique has been instrumental in helping breast cancer survivors feel confident and comfortable after surgery. When you walk through our doors, you will receive the personal attention and help that you deserve. Our goal is to offer you products that are not only fashionable, but also functional. Our services include bra, prosthetic, and lymphedema sleeve fittings. We also fit for diabetic and orthopedic shoes, compression hoses, and medical garments. Mercy Medical Supply and Mastectomy Boutique can help you find confidence, pride, and a sense of wholeness again.
In this episode of The Dose, we will explore the various health concerns of the spine and other key areas of the body. Nagging back pain won't go away? Well, we ask this question and more to our featured medical expert with Sports and Spine Institute of McDonough. Hi there, everyone. Welcome to SCB TV, The Dose, presented by Sweet Spot Smiles. And I'm so excited to have you on this journey to learn more about the health services in our community, right in our backyard. And we're opening up right now with the one and only Dr. Patel. He is with Sports and Spine Institute of McDonough. So excited to have you on the very first episode of The Dose. And what an amazing and fascinating area of medicine you're in, right? So explain what you do exactly.
So I'm a physiatrist, so I kind of look at ourselves as the primary care of sports medicine.
Okay.
You know, the field really stemmed from after World War II. A lot of people were coming back, had brain injuries, spinal cord injuries, amputations, and so a group of primary care doctors actually created a whole hospital for it. And it kind of just snowballed from there. So we started stemming into doing more of the musculoskeletal medicine stuff, which is basically kind of any joint, hip, knee, shoulder, back issues. So we kind of evolved into that, became what I like to consider the specialist in sports medicine and spine care that's non-surgical.
I see. So I've met individuals out and about who will say, well, you know, I had things done to my back or had procedures 20 years ago. Sometimes it didn't necessarily get better, but what I'm so fascinated about is that you shared previously that it's really been a lot of innovation in your area of medicine in the last 10 years.
Absolutely. You know, so besides MRIs and everything else to help us with the diagnosis, I would say the biggest thing in physiatry is getting an accurate diagnosis.
Okay.
Right? And so a lot of the diagnosis comes from just taking a great history and doing a great physical exam, and that leads you to getting the MRI. Unfortunately, now in medicine, we kind of jump the physical exam part, go straight to the MRI, and then try to correlate that with symptoms. So that's a great part about what my field has kind of evolved in is that we do a lot of great physical exam, look at the MRI and say, okay, that matches.
Yes.
And so now with the procedures that we can do spinal epidurals, we can do facet injections, there's even something called radiofrequency ablation. But again, it all stems on the accurate diagnosis and make sure that those symptoms correlate with the MRI. And with the invention of fluoroscopy, which is what we kind of use to guide injections, it makes that even more accurate as well.
Amazing. Yeah. So right now we have a demonstration of the knee. Explain how this works with exercise.
Yeah, so your knee joint kind of moves like a hinge. It does a little bit of sliding, but problem is your knee takes a lot of brunt of punishment, especially for those that like to run and work out and kind of put a lot of pressure on their legs or stand all day. So what tends to happen is over time you get wearing of not only your meniscus but the cartilage here that lines the knee, and so those spaces get a little bit closer, and that's what we look for on x-rays. So when we see knee arthritis, we know that there's two things that can help a lot with knee arthritis.
Okay.
Well, two major things that help a lot with arthritis. One is how strong the quadricep muscles are. So you have 4 muscles that kind of attach to the front of the knee, and they actually help stabilize your knee. So the stronger your quads are, we know from all the studies that that's what slows down the progression of knee arthritis. The other thing is weight loss, like we talked about. Obesity is an epidemic in the United States. For every pound of weight you lose 4 pounds per square centimeter of force through the knee. So it's exponential how much pressure you can take off your knee just by doing that. So strengthening plus weight loss. Huge in knee arthritis.
Now for someone watching us right now in Stockbridge, Georgia, and they're saying, but I have this nagging pain that won't go away, but my next door neighbor, they said they had treatment and it wasn't necessarily effective. But what I'm so amazed by is that it's actually customized, personalized medicine now, right?
Absolutely. So that, and again, that boils down to getting seen, getting examined, and actually figuring out what the problem is. But also going through the steps to help people absolutely learn how to manage themselves, right? So pain is very subjective. Pain is something that we all interpret based on what we feel. We all have the same kind of fibers, but our interpretation of pain is what's different. So some people, that little nagging backache is just, that's what it is. For some people, it interrupts their entire life, you know, and interrupts their function. And so that's kind of where we fall into place, is that we can help them regain function. And that's kind of what our field stems on. It's not so much how long you live, it's making that quality of life and optimizing that for as long as you live.
Well, right now I know you're holding a model of the spine.
Correct.
So this is amazing. This is what it looks like actually in our body.
To some degree, obviously there's a lot more blood vessels and that kind of stuff and muscles that attach, but you know, your spine is one of the biggest things, a support system for your entire neurological system outside your brain. So all the signals run through there. So what happens when people get nerve pain? Sometimes it's a pinched nerve, sometimes you have arthritis in the joints in the back part, and sometimes it's just wear and tear on your disc that causes this to get closer, and that can cause pressure on the nerves. So again, there's simple things that can be done for that. There's procedures where you can do epidurals, and there's different types of epidurals where you can actually inject into the spinal canal, and you're basically putting a steroid into your spinal canal to try to calm down the irritation to the nerve. You can also go right around the nerve to help calm the irritation directly to a specific nerve if you have an idea of where that nerve's coming from. And again, that stems from your physical exam and MRI. And the people that have that typical low back pain when they're standing for a long period of time, doesn't really travel down the legs, and it's usually kind of at or above their belt line, can often come from the arthritis in these joints. And so again, you can kind of do either injections into those joints, you can sometimes block the nerve that goes to that joint to kind of see if that helps with pain. And if it does, then you can even burn those little nerves to those joints that can sometimes give you anywhere from 6 months up to 2 years of relief of just pain in the back itself. Now, one of the major contributors to back pain is nicotine. So smoking actually increases the risk of disc degeneration and arthritis in the spine. So that's one of the things that we counsel patients on a lot that are smokers that have chronic back pain, is if you actually stop smoking, nicotine will slow down the progression of your arthritis, but also works in your brain and it makes you more sensitive to pain. So smoking cessation can actually reduce pain levels. So great information. I have to ask this. I know you certainly want us to be aware of wellness and obesity. Does obesity or excess weight impact the spine? Absolutely. So the more abdominal weight you have, the more it's going to pull in the front part of your spine, the more stress that goes through your spine. So sitting actually puts more pressure through your discs, but standing and obesity will put more pressure through the spine itself, and especially these joints in the back. So core strength and weight loss, especially abdominal weight, can take a lot of pressure off your spine. So we've got to get patients involved in their own health care, and that's kind of what we focus on. You know, I like to think of ourselves as a musculoskeletal cheerleaders as well. I'm really an advocate for patients who are overweight. I talk to them about the diets I do, the exercise I do, you know, and that's a big part of it, right? A lot of people say, oh, well, I can't exercise because my knee hurts, or my back's keeping me. Well, there's other ways to exercise besides running on a treadmill, walking, simple exercises, even breaking them into smaller segments of exercise so that you can still maintain that whole 30 minutes of exercise that they recommend a day, without doing it all at one time. So.
Which is so important, right? And I love that you are empowering us to do the very best that we can do.
Absolutely.
Now, I know you all see so many different types of patients here. Explain what sort of ailments your patients may come in with.
So most of the things that we see are spine related, and that's just kind of what gets referred to us. But you know, I'm a specialist in sports medicine, so we take care of anyone with hip, knee, shoulder, ankle, wrist, hand pain.
Wow.
You know, if you're a sports-related injury, I trained in concussion, so I know how to do concussion care. You know, we cover sports events as well. So we're kind of that holistic, all-encompassing musculoskeletal medicine, and even some neurological disorders. You know, there's patients that we see that have ALS, spinal cord injuries, traumatic brain injuries. Though that's not my subspecialty, our field does take care of that. We are trained in that, so we can always give input for that as well.
Before you leave us, Dr. Patel, I have to ask this. For someone that's saying, you know what, I hear what you're saying, I probably do need the health services, certainly that you're offering and explaining and educating us about right now, but they're saying, I don't want to see a physician, I don't want to have a prescription of medicine, because you know, emotionally speaking, it can make someone think, but am I really that sick long term?
Sure.
Speak to that human component of individuals needing help.
Well, you know, when people need help, the biggest thing is they got to ask for help, and they've got to they want to have to get the help. And so the big key that we try to do is tell people, look, it's not always about a medication. It's not always about seeing another doctor. It's about seeing, hopefully, the right doctor.
Yes.
And hopefully getting on a regimen where you can manage your symptoms without having to come back every week, every month, every 2 months, every 3 months. And that's kind of our goal, is to give you all the tools that you need so you can manage this for the rest of your life.
I love it. The goal is wellness. Stay with us. You're watching The Dose. In the upcoming segment, we spotlight hypertension, diet, and exercise with Eagles Landing Family Practice. Ready to reach your goals of wellness? Join us for critical information.
At Sports and Spine Institute of McDonough, we believe that sports and exercise are not only healthy, but encouraged to be part of your lifestyle. With repetitive motions and the overuse of muscles, you can obtain stiffness, soreness, strains, and possibly even injury.
The injury that I had was a strained back. I was always an athletic person, so when I came to Sports and Spine Institute, Dr. Patel gave me a personalized treatment.
Dr. Amrish Patel will not only give you a personalized treatment, he will also educate you on how to continue a healthy lifestyle so your body runs more fluently and more efficient.
So I'm in the process. My body's transforming right now, but listening to Dr. Patel, listening to the personalized care plan that he set out, I was able to strengthen the proper muscles to be able to perform how I wanted to.
Sports and Spine Institute of McDonough, where you will receive whole body care from a team ready to get you back in the game. Give us a call today at 678-866-3646 or check us out online at sportsandspineinstitute.com.
Regaining your health is easier than you think. At Eagles Landing Diabetes and Endocrinology, our physicians and friendly staff are committed to providing you with quality health care in a safe and efficient manner, providing treatment for diabetes, thyroid, hormone, and many other endocrine disorders. Our treatments for diabetes include continuous glucose monitoring systems, insulin pump therapy, and much more. Having issues with unbalanced hormones? Well, Eagles Landing Diabetes and Endocrinology uses BioT as a treatment for our patients. Eagles Landing Diabetes and Endocrinology uses top-of-the-line ultrasound equipment and is aggressive in providing treatment for our patients. All major insurance is accepted. Visit us today at 1050 Eagles Landing Parkway, Suite 302 in Stockbridge, Georgia, or call us at 770-389-9494.
At Eagles Landing OBGYN, we strive to create a warm and welcoming atmosphere. A place where women of all ages will be comfortable no matter what the reason for their visit. Eagles Landing OBGYN offers a full range of obstetric and gynecological services, all at one location. From FDA-approved 3D digital mammography, AIUM certified ultrasounds, bone density scans, urinary incontinence therapy, pelvic health therapy, lab services, infertility, pregnancy care, menopause treatment, fibroid treatment, bleeding problems, and yearly well woman visits. Our doctors specialize in minimally invasive surgeries, vaginal prolapse, and urogynecology, and much more. Our diverse group of physicians and friendly staff are sure to take care of your every need and more. At Eagles Landing OBGYN, we understand the importance of quality compassion care. Start the conversation today about your female healthcare needs. Call Eagles Landing OBGYN at 770-474-1919 to schedule an appointment. Visit our website at www.eagleslandingobgyn.com.
Welcome back, everyone, to The Dose, presented by SCB TV, Channel 182. I'm here with the one and only Dr. Colin Steele. Now, we're putting the focus today on the silent killer, hypertension. Now, many in your profession know how serious this can be, but someone watching us right now may not be aware of the true dangers. Explain.
So, hypertension is, yes, known as the silent killer, and a lot of people actually just don't know that they have it. So, we really encourage people to come in and get screened because you will not know and may not have any symptoms. Some people come in when they have chest pain, shortness of breath, but what we want to do is actually prevent that from even happening. So if we catch it early, we can prevent a lot of really devastating effects like stroke, heart attacks, vision loss, peripheral vascular disease. There's a lot of things that actually are affected just by high blood pressure that people aren't aware of.
No. So, Dr. Steele, I know we say that hypertension is the silent killer, but we're very much aware of words like stroke and heart attack. And you're saying if these things go untreated, high blood pressure, it could possibly lead to it.
Yes, so over time, actually, blood pressure will actually cause damage in the vessels. So if not treated, you put yourself at a way higher risk to actually either have a bleed from too much pressure in the brain, or the plaque will build up and you can have a stroke from one of those pieces actually breaking off.
Wow, and that's very serious right there. Now, I know like so many of our disease states, we talk about guidelines, if you will, that are set. I know you and your medical colleagues here are very serious about meeting those guidelines. What are the guidelines for blood pressure? Where do you want it?
So our goal pretty much overall is less than 140 over 90. So there's actually different stages of hypertension. So there's pre-hypertension, which is actually considered 120 to 139 over 80 to 89. And then stage 1 is actually 130 to 149 above 90 to 99 diastolic. And then there's stage 2, which is above 160 over 100. So if we can catch people in the pre-hypertensive stage or even stage 1, we're preventing a lot of problems down the road.
Wow. Now, someone watching us right now may be saying, but if I go and Dr. Steele checks my blood pressure, they may already be in stage 2. And they're saying, but I don't want to be put yet on another medication. Explain how it doesn't always mean you have to go on medication. And if so, the options today are much more manageable than in the past.
Yeah, luckily we do have a lot of medications out there now and even combo meds. So we don't have to actually keep continuing to add an additional pill, which people don't like. But then we also counsel them on their diet, exercise, you know, watching their salt intake, being active. Weight loss can actually improve their blood pressure drastically.
I have to ask this now, there's so many disease states and sometimes certain groups are more prone to have it. Is there anyone that's more likely to have hypertension than other groups?
Actually, African Americans are at more risk, and we actually do have to sometimes treat a little bit differently with them. So there's your typical standard medicines that you may use for people that typically work, but African Americans we have to consider other medication treatments.
Wow, and I guess that's why it's so critical to get screened, because I don't want to miss the obvious, but when we say the silent killer, I could have blood pressure issues and not even realize it.
That's right. That's right. And actually 1 out of 3 people right now adults have blood pressure. 1 out of 6 don't even know it. So it's a big deal.
And of course, there's so many services offered by Eagles Landing Family Practice here. Maybe there's a young man, he's 43 years old, he hasn't had a physical or seen a physician or medical provider in nearly a decade. Make a case for him to come in and get screened, especially for blood pressure.
That's right. Anybody, honestly, over the age of 18, you absolutely should be screened for high blood pressure and come in for your physicals, because then we can potentially discover something way early on. And you want to go every year. It's really important. Things can change. You don't know it, but they can change. And then we're there to help you. We'll screen you. We'll treat you if need be. We also have diagnostics available if they need to, so such as an echocardiogram and a stress test. We can do all of that here and really tailor to their needs.
Dr. Still, so many of us say, but I'm not in pain, right? So why do I have to go?
Yes. So, because we actually will treat you when you're sick. We love to treat you when you're sick, but we actually want to keep you from being sick.
That's right.
And so you don't want to, honestly, we want to see you when you're well yearly, so we can go over everything, make sure that we've answered all of your questions, and that you're aware of your potential health risks in the future. So just coming in for, maybe a sinus infection, we're not getting the whole picture for you. So we really want to treat the whole head to toe.
Stay with us on The Dose. We are serving up some information and much more. Now, be honest, are you using that salt shaker more than you should? Well, I'm not going to be the one who tells you the truth about it, but the one and only Dr. Vera LaFosse with Eagles Landing Family Practice will be. Welcome. Thank you for joining us.
Thank you for having us.
Now, there's someone saying, okay, Dr. LaFosse, I'm putting a little bit of salt on my food. What's the big deal?
The big deal is you're at risk. You're putting yourself at risk for hypertension. Many people say, I only just add a little bit, but over time that can actually make huge effects to your meal and to your overall health in general.
And so when we talk about the salt shaker, you shared with me previously that, wait a minute, it's not just the salt shaker or putting it inside of that shaker, it's the processed foods that we're eating as well?
Yeah, exactly. A lot of people say, I don't add salt into my food. But they would eat something that maybe is processed either in the freezer, comes prepackaged, unfortunately microwave meals, things like that, canned foods, unfortunately, how do they preserve it? They put it on the shelf. How do we do that? With salt and preservatives. So it's important to realize maybe you may think you're eating healthy because you're not adding salt, but just kind of be mindful of those things that are processed in a bag, in a can, or in the microwave, in the freezer section at the grocery store.
I see. Now we're putting the focus on hypertension, blood pressure. So if someone didn't do that in the past, or it's family genetics to a certain degree, or they're aging, or they just have been diagnosed with hypertension or blood pressure, they come see you or one of your colleagues here at Eagles Landing Family Practice, right? And they're saying, okay, you've been diagnosed with stage 1. What does that mean? And when is it time perhaps to look at some medical options?
So usually if your blood pressure, just to kind of keep it simple, if you notice your blood pressure is creeping up in the 140s or the 140s and above, over 90s, that's a time to be like, okay, now I need to definitely kind of seek some medical attention. Lifestyle changes like we discussed before, diet, if you are able to get a little bit of exercise in, that's very good. So when they come to see us, we'll discuss those things. If it's to the point where lifestyle changes can help us, but then we have other options such as medications, things like that. Now medications, that's one thing that you kind of have to, find what works for you in particular. What are the kinds of medications we have? That would include medications to help you urinate. You would hear people call it a water pill. And then you have other medications that help your heart rate just get down just a little bit to help your heart not to have to work so hard. Then you have other medicines that work on your actual kidneys. So there's different kinds that can actually help you out, definitely. But you come on over and we'll help you kind of figure out what's what.
And I want to right now horn in on the true danger of hypertension, right? Because it's allowing the body, the heart, if you will, to work a little harder than it's supposed to.
Yes, ma'am. And we talked about it being a silent killer. So the fact that your heart is having to work harder, it leads you to things like stroke and heart attack. So it's very important to have your blood pressure controlled from all aspects. If it's lifestyle modifications, if it's medicine, if it's getting some exercise in, things like if you're a smoker, to decrease how much you're smoking, or to stop smoking altogether. Things like alcohol use, excessive alcohol use can actually increase your blood pressure too. So it's very important to kind of keep all those things in mind to really get a handle of getting the blood pressure down.
Certainly, which is so critical to our health.
Absolutely.
Love that. And we can make a difference in our own lives and be around for our kids and also our grandkids.
Absolutely.
What a joy speaking with you. Well, stay with us. You're watching The Dose.
health is the foundation for a life well lived. And no matter where we are on our health journey, our best health is discovered when we surround ourselves with people that empower us to be our best. At Eagles Landing Family Practice, our straightforward approach is redefining primary care by delivering premium health services that fit into the pace of your life. Our primary care physicians take the time to listen, to discover the root causes of the disease, and to walk with you on your health journey. Our in-house specialty services gives you peace of mind, so you can get the treatment you need when you need it. With multiple locations and extended hours, we provide the flexibility you need to receive primary care close to home, and then get back to enjoying your busy life. At Eagles Landing Family Practice, we want to be your partner in health, and we want to do that by providing better, more convenient primary care, because we believe that when primary care is delivered with excellence, you and your family will be better served, your lives will be improved, and the cost of health care will go down for everyone.
At Hyde Prosthetics, we're committed to providing personalized patient care. We believe that an open line of communication with our patients is essential to their success. From children to adult, Hyde Prosthetics works with all types of patients, providing below the knee, above the knee, and arm prosthetics.
Every time I come, it's always a smile, it's always joy, and it's always fixing my legs, and they're perfect.
With over 50 years of combined experience, Hyde Prosthetics strives to design a work of art that unifies technology, functions, and gives you the perfect fit. Striving to provide his patients with the best possible care, Todd Hyde can even make house calls. Hyde Prosthetics, the art of making a difference. Give us a call today at 770-892-0170.
You're watching The Dose. Remember to join us on Facebook at The Dose TV Show and visit our website for updates at www.thedosetvshow.com. Be sure to tell a friend.
Hi there, I'm Dr. King. We are so excited to offer our patients Invisalign. Invisalign is a clear retainer system that allows you to straighten your teeth. It is an amazing therapy which is easily removable from meals and brushing. Most people won't even realize that you have aligners in because they are nearly invisible. Our program with Invisalign also frees up your busy schedule with your office visits only 4 to 6 weeks apart.
You were made to move, to progress, to not just accept what you see, but imagine something new. At Invisalign, we use the most advanced teeth straightening technology to help you find the next amazing version of yourself. It's time to unleash your secret weapon. It's there, right under your nose. Get to your best smile up to 50% faster.
So if you feel like you would like to pursue straight teeth, contact our office today for a complimentary consultation. On behalf of myself and my team, we value you and look forward to seeing you soon at Sweet Spot Smiles.
My name is Amish Patel. I am a physiatrist, which is physical medicine and rehabilitation doctor. I've always had kind of a knack for wanting to know what the problem was and how to help people, and this field just kind of fit. I used to be a physical therapist for 4 years before I went back to medical school, so it also kind of made it just fit very well. You get to spend a lot of time with your patients, get to diagnose them, and then I can also kind of help them with the recovery and teach them how to do things so that hopefully they can manage it for the rest of their lives. It's seeing patients that take control, having that patient that comes in and they've lost 30 pounds because they're doing the diet I recommended, or they've started exercising like we recommended. Talking to that patient that stopped smoking because I really harped on them on how much it's going to affect their whole life. But the greatest satisfaction is really when the patients come back after procedure and they're doing 100% better. They can spend time with their families, they can walk, they can eat, they're not getting interrupted by their pain.
Colin Steele, and I am a family medicine doctor. Well, I think I decided to become a physician just to, honestly, most people do, to help people and really actually make a difference in their lives. I think the biggest reward is actually seeing them achieve their goals. So by us, really honing in on how they will respond to our treatment plans and actually coming up with them together, and then seeing them come back in and they've actually done it. They feel better. We're on a road to a better life. That's the great thing about family medicine, honestly, is that we do build relationships with our patients and we get to know their entire family, which is something that a lot of people don't get to do. And we're involved with them pretty regularly. We know their kids, we know the parents, we know the grandparents, and we know about their lives, where they work, you know, what they do for fun. And it really does make a difference in treating them.
Before my knee operation, I took my health for granted.
My joints became severely deformed. I couldn't even walk.
The team at Resurgence, they really cared about me.
They don't just do your procedure and then leave you alone. They sit there and they're with you every single step, all the way through.
With the most specialized physicians offering comprehensive and compassionate care, Resurgence Orthopedics is Georgia's most trusted orthopedic team. We'll get you moving again. Resurgence Orthopedics. Reach for more.
You're watching The Dose. Remember to join us on Facebook at The Dose TV Show and visit our website for updates at www.thedosetvshow.com. Be sure to tell a friend.
Covenant Care Pediatrics is passionate about providing comprehensive, safe, and effective care that is grounded in scientific research based on the latest guidelines, along with a dose of common sense. We provide innovative care from our breastfeeding practice to programs including newborn care, vaccines for pregnant moms, asthma, and many more. We are a medical home for children, coordinating all of their care, even when out of the office. Our advanced electronic record and patient portal allows us to provide amazing care for kids before, during, and after the visit, constantly tracking children's health. We keep busy parents up to date with our practice and the latest advances in keeping kids healthy both in print and online. Our ultimate goal is for every child in our practice and our community to reach his or her fullest potential. We spend as much time as necessary with parents and children answering questions and teaching about health, nutrition, and wellness. From short wait times to same-day appointments, we do everything we can to help busy parents. Come visit our new office at 245 Country Club Drive, Suite 200A, and visit our new breastfeeding center. Covenant Care means caring for your children as we do our own. That's our promise.
Compassion is at the very heart of Southern Grace Hospice. With the support of Southern Grace Hospice and its skilled staff, patients and families alike can focus on what's most important, enjoying life together and living as fully as possible. Coping with a life-limiting illness can be overwhelming. With the high-quality care and support provided by Southern Grace Hospice, patients and their families discover that end-of-life care includes hope, love, support, and dignity. Hospice services are covered by Medicare and most private insurance plans and include clinical, emotional, and spiritual services for both patients and families. Southern Grace Hospice, where your family is our family.